My name is Dr. Beverly Coleman, and today I will be lecturing on the fetal musculoskeletal system. Watch the hands and feet. The objectives of this talk are to emphasize the importance of more detailed evaluation of the hands and feet on ultrasound examinations. I intend to illustrate examples of normal and abnormal anatomy that we can currently see with the available ultrasound technology, and also to emphasize an organized approach to evaluating the hands and feet, which can assess and diagnosing multiple musculoskeletal disorders that may be associated with syndromes and aneuploidy. Our approach is not only to document the presence of the four extremities, including the hands and feet, but we also cover all that you see here. For example, the number of digits, the size of the digits, whether there's normal alignment, and we look for specific pathology and other conditions. Let's start with what is normal. You probably have not really thought about it, but the hands and feet are much easier to evaluate earlier in pregnancy rather than late in pregnancy. And the reason for that is probably the degree of intrauterine crowding as the pregnancy advances. And so the fetus is larger relative to the amniotic fluid volume with less motion. And the hands and feet can get hidden under body parts or adjacent to the placenta and the uterine wall. This table lists the musculoskeletal structures that we can see from the very early part of gestation to the late third trimester. Clearly, the hands and feet should be visible in all cases, if normal, at approximately 12 to 14 weeks. Here on this very early transvaginal scan, we can see that the limb buds are in motion, and there are 4 buds clearly visible. A little bit later in gestation, we can see the increase in activity at approximately 12 to 13 weeks. Notice the movement of the embryo here. The very first long bone we can measure in pregnancy is the femur, and there are nomograms from 12 weeks and beyond.